Gallbladder pain can be sudden and severe. Generally speaking, it occurs after meal, and most of the time, patients would describe that they had a heavy meal. By heavy, they mean pretty fatty meal that may have precipitated the attack. Now, that could take a few minutes, or it might actually wake you up in the middle of the night after you had, say, a pizza with a lot of cheese and other food that contained quite a bit of fat that night. To understand why do you get abdominal pain from the gallbladder, we really need to understand, what does the gallbladder do? So, let's understand how the gallbladder functions so we can understand what happens when it malfunctions or dysfunctions. The gallbladder essentially stores bile from the liver. So the main source of bile in our body is liver. We all know what bile is. At some point, we've all had an episode of vomiting, and we've noticed that green, yellowy color. Or we may have had, unfortunately, diarrhea, where again, we describe this very light green or clay color, as some people call it, or very light yellow diarrhea. So what does bile do? Well, the function of the bile is to absorb fats. And with the fats, there are some fat-soluble vitamins, such as vitamin A, vitamin D, vitamin E, vitamin K, with a lot of other actually nutrients that gets transported from our intestine to our bloodstream and through the liver, and the body can function at that and use it to obviously function. Fats are extremely important, especially cholesterol. A lot of our hormones are actually made of fats. So that is a function of the bile. And the problem becomes when we either have too much bile or too little bile. And we will discuss that in a little bit. So when the gallbladder malfunctions, if we want to call it that, you can get pain or digestion issues, as in maldigestions. You may not be absorbed or able to absorb fats easily. And that's what people describe this inability to basically flush their toilets, launch the stool after they use the bathroom, because fat is lighter than water, and so fat can actually stay on top of that water, and it becomes hard to flush. That usually means there's a lot of fat in the stool. Now, this may or may not be a sign of gallbladder problem. However, it is something to watch out for. So what happens and why do we get malfunction in the gallbladder? Well, there are two types of problems that can occur with the gallbladder. One of them is the gallbladder is not able to empty the bile from it. And that's called biliary dyskinesia. So what does that mean, and how does that happen? We don't actually know why do people get biliary dyskinesia. There are some theories, but nobody really knows why. So if you think of the gallbladder, if we said that the liver is the main source of the bile, well, what does the gallbladder do? The gallbladder is a little overflow tank. What it does is it regulates how much bile is actually produced, so you don't have these symptoms of diarrhea, clay-colored stool, and it adjusts to the fat and how much fat we eat. And the gallbladder will almost adjust its amount so that we can absorb the fat in the diet that we actually consume. That is the function of the gallbladder. Now, when our diets, especially nowadays, consists of significant amount of polysaturated fats, we eat too much fat and overall consume too many calories, along with obviously all the other additives that we have in our food, that may lead to having what we call sludge. So sludge is very thin, mud-type material that actually precipitates in the gallbladder. Over time, that sludge could turn into having small stones within that sludge. Those small stones could get larger, and that's when we can start having issues. Now, the size of the stone doesn't matter, because the disease process with gallstones is that those little stones, or even the sludge, if you think of, again, the bathroom, if you start noticing that their stool may not necessarily be hard, but that does not mean it cannot clog the piping, right? So that's exactly what happens with the sludge in the gallbladder. The gallbladder tries to empty its bile, but the sludge will flow with it as well. As it flows, the gallbladder is a little balloon-type structure, but it has a little neck, and a very small drainage system. When those stones get stuck in that drainage system, you can imagine the gallbladder is trying to squeeze and it's not able to do that. That's when you start getting the pain and discomfort. The pain can start in we call it epigastrium, almost like just below your breastbone, and it could either radiate to both sides of your upper abdomen, or it might go straight to your back. And occasionally people complain of right shoulder pain, which we call referred pain. Well, who is at risk of developing these stones? The people who are at risk of developing these stones, unfortunately, are females. And it tends to be younger females who are what we call of fertile age. And the reason for that is during pregnancy, there are these drastic changes in weight, along with the hormonal changes that occur during pregnancy, and therefore they are more prone to getting gallstones. So that is one of the group of people who are actually more prone to getting gallstones. Patients who lost significant amount of weight, whether it was intentional, as in diet-based, whether it was medication-based, or they've had bariatric surgery. Those people are more prone at getting gallstones. So huge changes in weight, especially when there's significant weight loss, that tends to actually expose patients to getting gallstones and makes them more vulnerable to developing these stones. Now, what are the symptoms that occur with gallstones? Well, the pain could be fairly sudden, or it may start as a nuisance pain and rapidly increase in discomfort. If you start getting pain with nausea and fevers, you most certainly must go to the emergency room, or at least you must be seen by a physician immediately, because they're going to need to make sure that you do not have what we call acute cholecystitis or pancreatitis, or one of those other conditions which may develop as a sequelae of having a gallstone and a complication of gallstones.